So today we're going to talk a little bit about what I guess companies we've been doing with companies over the last God, it's 3 months now. So when this first happened, our clients quickly turned to us for guidance to stay open, especially our essential clients, or clients with in the essential portion of the workforce. So what we did at DMC was we combined our different service lines, our occupational health and safety, our industrial hygiene, and occupational health, which is we have a couple of occupational health nurses on staff, and figured out what we could do to help our clients. So, you know, we've been into business for a long time of doing risk assessments or hazard assessments and writing mitigation plans for various risks and hazards. So we turned our attention to figuring out about COVID, and then how can we apply our already best practices to that to help our clients. So we interfaced a lot with public health officials, and just thinking outside what normal work environment would look like. So the first thing we needed to do, of course, was learn what we could about COVID-19, the epidemiology of the disease, how the disease spreads, high risk, the elderly, immune compromised, people with underlying chronic conditions, that 80% of people have mild symptoms, that asymptomatic people can still transmit. But apparently, as with COVID-19, I guess a lot of you are learning, new information is becoming available all the time. And I know recently the World Health Organization released some information saying that asymptomatic people might not be transmitting the disease as much as first thought. So it's a fluid situation. We're always learning new things. We know that it's transmitted through droplets and contact, so contaminated surfaces and objects. It can survive for hours to days. So I guess we needed to take what we knew, and then how can we transmit that to the workplace, and figuring out what companies need to do. So what are employer responsibilities? So, every employer has an obligation to provide a safe workplace. So what can employers do to ensure that their employees and customers are as safe as possible? So we need to make sure that the employees understand, what their roles and responsibilities are. So of course, employers have to provide a safe workplace. So we need to have a plan, an operational plan, mitigation plan. People call it different things. We need to make sure we communicate that plan to not only our employees, but our customers. We need to monitor that plan and update it with new information, because new information is becoming available all the time. We need to ensure that we're following those protocols and the process. And you also need to make sure that you have some kind of a response for a positive test, or if you know that someone within the organization has been called for testing, or someone in their household, or I guess their bubble, now that we've progressed through some of the changes. So what does a safe workplace look like with COVID-19? So the first thing you need to do is a hazard assessment or a risk assessment, and that's individual to your workplace. Every workplace is different, so you need to do it as it applies to your workplace. And you also need to do it with a different lens. You need to look at your workplace from the perspective of yours, obviously, your employees and your customers. What are the health risks? And from a safety perspective, what are the risks? So you need to walk through your organization, depending on what that looks like from a day-to-day perspective, and develop a chart or a list of all the possible risks, and looking at it from the perspective of what your employees' day-to-day looks like, whether they interact with customers, what it looks like for customers, and then take the other various things into consideration. You also need to look at Health Canada and the protocols, and again, that's changing, so you need to make sure you're up to date on that. So using the different lenses will allow you to see it from different people's perspective and make a more comprehensive list of the risks or the hazards that you'll find from a COVID perspective. So once you do that and you have your list, then you need to figure out, your mitigation or your exposure control plan. And it is mandatory in the province of Newfoundland and Labrador to have a plan, and they may ask for it. So occupational health and safety government services may ask to see your plan. So you need to assess each hazard and see how that relates to what we know about COVID. So you're looking at each individual risk. So from your staff's perspective, how do your staff interact with each other? What's the demographic of your staff? Do they have underlying conditions? What's the age of your staff? What's the age of your customer? Or do any of your customers have underlying conditions? And that depends, of course, the type of business you're in. Then you might look at common areas. So you may have to look at options for common areas. Where are people gathering together within the organization? You might need to rope them off. You might need to take half of the chairs out. What are the things that you need to do in that area? The entrance. So how many people do you have coming, and how do they all come at the one time? Do you have automatic door opener? Maybe you can prop your door open. So can you have multiple entrances where everybody is not coming through one entrance? So you just need to think. You need to start in a parking lot, and then walk through every area and break it down, figuring out what is the risk of opening the door. And if everybody does have to open the door, who's going to be responsible for cleaning the door? So those kinds of things need to be taken into consideration. Physical distance, of course, is one of the major things that has been recommended, and it's not always possible. But is it possible if you could reconfigure your workplace? Or can you move things around in your workplace? I mean, is there a way to physical distance, and can it make sense? Contractors, do you have contractors that come on site? And if you do have contractors that come on site, how are you going to communicate this plan to them? Or do they have a plan that you have to adapt to? And you need to be careful, because if you have people come on your work site, you need to make sure they're following the rules, because you can quickly erode the trust from your customers and your employees if there's different sets of rules. So you need to make sure that if you do have contractors on site, that they're aware of what your mitigation plan is, or they've presented you with a mitigation plan that it meets the standards. Are you able to maintain the quality of your work? So will the quality of your work be compromised because of the processes and protocols that you have to put in place? Are you still able to operate, and are you able to do the work you previously did to the same standard? Customers and interaction. So depending on whether or not you have customers that enter your workplace, what are you going to do to make sure that customers are aware of what is required of them? Smoking. In a lot of the organizations where they had smoke shacks or smoking areas, we've closed them down at a lot of the companies we work with, simply because they weren't able to maintain physical distance in those areas. So you're going to have to take that into consideration and figure that out. High touch surfaces, doorknobs, and light switches. So just walking through your organization, looking for what are the high touch areas, and maybe you can leave doors open, or who is going to be responsible for increasing the amount of cleaning that is going to be done in those areas. Any shared surfaces like microwaves, keyboards, how are you going to either eliminate the sharing, or how are you going to maintain the cleaning of those areas? Mail handling. We actually, in the early days, of course, because of the Canada Post situation in Newfoundland and Labrador, we actually went into a lot of organizations and put in the protocols for handling the mail. And what about elevators? Are you in a building where it's your elevator, or is it a shared elevator where there are other organizations in the building with which you work, and who's going to be responsible for cleaning the elevators? If there's any shared tools, can we eliminate the sharing of tools? And if you do need to share tools, then how are you going to sanitize in between? So I'm only going over a few of these just because I want to give you a sense of the kinds of things that you need to think about in your particular space, so that you can start to think about how you're going to mitigate that. There's also washrooms and money handling. How do you ensure that, if you can't physical distance in a washroom, how are you going to ensure that, there's only one person in there? And where are you going to place sanitizer if people got to open the door to get out of the washroom, or can you leave the door open? With regards to money handling, most people are choosing not to handle paper money or coins, and they're opting to either use debit or credit. And if you're going to do that, how are you going to communicate that to the customers? So you need to think of all those things when you're from the lens of all the different aspects you need to look at within your particular workplace. So once you start to consider, you've made your comprehensive list of all the possible things, then you need to think about what are the possibilities you can do to start mitigating those risks. So are you going to do pre-screening? So are you going to have a questionnaire for people before they come to work? Or are you going to do temperature checks? And we have clients doing both of those or some of that. But if you're going to do it, then what does that look like? Personal protective equipment. If you can't maintain physical distancing and you are required to use personal protective equipment, then how does that look? Can you access it? And if you can access it, do people understand how to don and doff the equipment? What about the procedures for storage and safe handling, and understanding what they need to do to dispose of it? Or if it's multi-use personal protective equipment, then how is that sanitized? So people need to understand that. So what kind of procedures and protocols are you going to put in place, and how are you going to train your staff to understand how to effectively use personal protective equipment? Cleansers and sanitizers, they need to have a certain percentage of alcohol in order to kill COVID. Where are you going to place them? Can you access them? Making sure they're approved by Health Canada. Do you need the automatic dispensers? Can you find some with pumps? I mean, there's all kinds of questions to ask. And then, of course, where they're placed within the organization. Cleaning and disinfecting, they're saying that you need to increase the frequency of your cleaning, and it needs to be more rigorous. So if you use a cleaning company, are you going to have a conversation with them to determine whether or not they can increase the cleaning, or the products that they're using, do they actually kill COVID? So these are discussions you need to have. If you do it internally, if you are responsible for the cleaning, then how are you going to make sure that you've increased the cleaning within your organization? Hand washing stations, is it possible for you to have people to have access to warm water and soap? Is it possible that people can access that readily? And if they can't, then obviously you need to increase the access to hand sanitizers. You need to make sure you have lined garbage bags so that no one actually touches the garbage. Physical distancing, can you remove some of the hazards that are within your workplace, or can you maneuver the work site so that people have adequate distance between each other? Then there's engineering out the hazard. Can you isolate people from the hazard? As you can see in a lot of the public places now, there's a lot of plexiglass. So is that something that you're considering? And if it is, then where can you access it, or who can make it, and how does it look for you and your organization? Just because not all of them would be the same. Signage is critical right now. We're all looking for signs. I know when I go to the grocery store or the drugstore, I'm looking for the sign where I have to stand. I take comfort in the fact that someone has measured the 6 foot distance, and they have me standing where it's safe for me to stand. So signage is really important for the customer and for your employees, and even the reminders about how to wash your hands, or etiquette for sneezing or coughing. Signage for those kinds of things is really valuable right now. The number of people that you have in your workplace. Are you going to be able to have the full capacity, or have your company at full capacity, or are you going to be able to have a limited number of people within your organization? And are you going to have staggered start times so that everybody doesn't come at the same time? You kind of stagger the start time, especially if you're going to be doing temperature checks or questionnaires. How are you going to do that with people arriving? So figuring out the logistics of that will be really important. Whether or not you're having travel, what's the process going to be for traveling? Are you going to be logging clients coming and going? And if you do, how does that look? There's some companies have foggers, or is that something that would be realistic depending on your organization? The washrooms. So all of these things you need to take into consideration for how you're going to have a look for that reopening, or staying open, or people returning to work. Then you need to think about, once you've thought about how you're going to mitigate all those risks, and you've looked at the various possibilities, what we've been doing for companies, when we do the risk assessment and we walk through the organization and we put together all the risks we've identified, and then we put in the possibilities for mitigating that, then there's always a discussion as to what can work and what cannot work before we actually put it into a mitigation plan for that company. And then you have to communicate it. And communication and your communication plan is critical for easing anxiety and stress for people. There's a lot of rumors and misinformation. So, how you choose to communicate the plan that you're going to put in place for reopening or having people come back, or if you're staying open and you've already been open, it's really important for people's mental health how you communicate this. Of course, you need to have a process in place anyway for the regulatory body in Newfoundland and Labrador. That would be government services with occupational health and safety. You need to think about how you're going to communicate that to your staff. If possible, a discussion face-to-face over Zoom or whatever works for your staff, but you need to have a clear communication plan. And what we've seen is we've used different communication plans depending on the company and depending on the staff and how they take in information. So you need to think that through. What is the best way to communicate with your staff? For some of our clients, we've done Zoom calls, and we've actually had our occupational health nurses on the call with those employees so that they can ask questions and feel comfortable that everything has been thought through in order to bring those people back. So you know your staff best, and you need to think about what's the best way to communicate the plan to them. Your customers, how is it best to communicate with your customers? Will that be on your website? Will that be a phone recording? Will it be signage? Will they just find out when they get there? And maybe you need to have someone assigned to talk to customers when they arrive, so it puts them at ease a little bit as to what they're supposed to do, because the first time if they're coming back to a company that hasn't been open before, they're coming back to a workplace, then you might need someone assigned to make sure, even if it's with their fellow employees, to make sure they understand what they need to do. The same for contractors or people who regularly do deliveries, what has been communicated to them. So they must follow what your protocols are. So it's important to communicate in advance with them. So you might want to have some kind of an orientation to return, and whether that's in person or video, a written document, but it's important to let them have an opportunity to ask questions. We need to be mindful that everybody is going through the pandemic in a different way. Everybody's experiencing something different. For some people, it's very stressful. They could have immune compromised or aged people at home, or children that are sick. So there's a lot of different things. It might be bringing up, it might be re-traumatizing people from other things that have happened in their lives. So we just need to be empathetic and understanding that people are going through this differently. So giving people the opportunity to ask you questions during some kind of an orientation, I think would be really valuable. So two-way communication, and using lots of common sense is really important. And remember that workers have a right to refuse work that they feel is unsafe. So we're definitely seeing an increase in workers refusing work. And there is an escalation process that gets to government services if indeed workers feel that the workplace is not safe. So we're seeing an increase in that, and I don't think as an employer you should be really alarmed about that. That's going to happen because people are really nervous, and there's no rule book for this. We're learning it as we go. So those are things I think that you shouldn't take personal. We've worked through them in a lot of cases to be able to put people, to put their fears at ease. But, sometimes they do have valid concerns, and we need to, as I said, be empathetic and understanding what people are going through. So keep that in mind. So then you need to update your program as you go. As I said earlier, that there's always new information and things are changing. So try to keep things as current as you possibly can. Provide regular updates. But I would highly recommend you not relax any of the protocols that you put in place without prior communication. So if indeed, we do, now we've moved from through the levels, it's important that that you communicate with staff if you are changing or relaxing some things, to give them an opportunity to express concerns if they have any, but also for people to be able to adapt, because people immediately feel fear if something is changing or they think that people are getting relaxed about something. And also, I can't stress enough that everybody got to follow the protocols, no exceptions. Employees are watching and customers are watching. And if some people are not following the protocols, the trust will be eroded pretty quickly. And there's a huge amount of trust with, with bringing people back and allowing customers to come in. So everyone must follow the rules, no exceptions. As I stated, re-communicate if indeed you're going to make any changes. know when it's appropriate to call 811 or advise your employees to call. It's also valuable to explain new terms. And I guess when I first did this presentation a couple of months ago, the terms were newer, and now we've probably even have a little bit of a greater understanding. But don't assume that everybody understands quarantine and self-isolate and all the different things that people are talking about now, donning and doffing personal protective equipment, you know, terminology that people just haven't been. For some workforces, it's common, but I think it's important to make sure that you take the time to provide definitions and don't assume that everybody understands what that means. Have a disciplinary process in place for workers following the process and knowing and following what their responsibilities are. You know, and if you already have a disciplinary process within your organization, then and that's appropriate, then you can choose to follow that. If not, it is important that you react quickly for people who do not want to follow the rules, whether that's customers or whether that's employees. And we've had some experience with that with some of our clients over the last couple of months, where, you know, employees thought some of the things were stupid and didn't want to follow the rules, but other people were very fearful. So just make sure you react quickly. Don't let that go on too long. I would suggest that you even set it up front, what the possibilities are going to be from a responsibility perspective and a disciplinary perspective. Again, have protocols for putting on and taking off personal protective equipment if that's not something that people are used to wearing, because you know, taking your mask off or gloves if you're wearing them, you know, you need to be careful doing that and know the process. So you might need to re-communicate the plan, and you might need to re-communicate some of these things you know, over and over for people to understand it. Don't assume people might get it on the first go around, and have your process available so that people can read it. So the final thing I'm going to talk about is having a response plan. So you need to have a response plan for a positive test, or if someone is going to be tested who's closely connected with someone in your organization. So make sure that you know the communication plan with employees and customers, whether or not you will be involved in contact tracing. If you follow public health instructions, they will advise you what you need to do. Just be cautious of people's personal information. This, you know, COVID-19 is an illness, and we need to be mindful that people still have a right to confidentiality. And I know that some of that is eroded somewhat with contact tracing and these kinds of things, but, you know, just be sensitive to that process. It's valuable to assign a response team, and depending on the size of your organization, one person may be the whole response team, or you might designate different people to have roles. So you might want to have a team lead. So they're the person who are running that whole process from a response perspective. And I think you should just operate under the perspective that you are going to have a positive test, or you are going to have someone within your organization that's going to be called or have to go for testing. And we have gone through this, so I'm sharing with you the experiences that we've already had to go through for some of our clients that we've been working with over the last few months. And you're scrambling because we spent so much time trying to put all the mitigation processes in place that, you know, you kind of forgot that you might get that call that you have someone in your organization needs to be tested, or someone in their family does. So so I'm asking you to learn from what we've already gone through and assume you're going to have a positive test, so that you've already thought it through and you don't panic, or you don't have everybody helter-skelter. So, you know, you might be involved with contact tracing and tracking. So if there's things you can do within your workplace where you know where people are sitting, or you can assign, I know in some of the hair salons that we helped open, you know, we have people assigned to certain chairs, you know, just being able to cut down on the movement so that if indeed you do have to do contact tracing, that you're able to do that. Some people have divided their employees within teams so that if something happens to one team, the whole team is not taken out. So just thinking those things through. Whether or not you have to contact a local agency, so food inspection, if indeed you do have a positive case. Who will call public health? And public health are the people who will tell you what you need to do. So that, you know, they will tell you what part you need to be involved with. Communications, you know, who is going to communicate with the affected person? And you need to be mindful that they do have a health condition. So and they could be worried about their family or who they may have infected. So just be cautious and empathetic towards that person. Who is going to communicate with your staff? Who is going to communicate with customers? Whether or not you have quality assurance, sanitation, you know, who is going to do, if you are required to do a deep clean, because you know that you have the type of business that will require that, then who is going to, you know, do you have a company that you've already have in your Rolodex that you can call, or do you need to seek somebody out, or will it just be a routine cleaning? You know, what do you need to do? So it's important to have thought through that in advance. And again, are you going to be required to provide floor plan information for contact tracing, or, you know, about the employee's workstation? So, you know, just having thought that through in advance will make it go so much calmer from a business perspective and for your employees and your customers if you've already prepared for that in advance. So that's it for my little presentation. If you got any questions, I'm happy to answer some of them. And like I said, you know, feel free to reach out to me anytime to have a chat or talk through something. I'm here to help.